I found out I was HIV positive, it was in 1999, and I was in Florida. It was a real scary time. I was having health issues that I didn't understand. Um, in the back of my mind, I kind of knew that something major was wrong, but it was just a really scary time. I wound up getting sick, some weird blood infection, as I recall, and I went to the emergency room at Mount Sinai Hospital in Miami, Florida, and that's when they told me my diagnosis. Um, it was a very scary time. I remember feeling desperate and like it was absolutely going to kill me. Having to tell my family about my diagnosis was very hard. At the time, I thought I was going to die and that I needed them to pretty much plan a funeral. I think they thought that too. But once I got some help and allowed them to adjust from the shock, I guess, they tend to have taken it a lot better. Like I say, I'm one of the lucky ones. The antivirals are working for me and I'm healthy. At the time, though, we had no idea what was going to happen. So it was an extremely scary time for me and my family. There's actually a lot more that our community can do to support people with HIV and AIDS. Um, Making the antivirals available for everyone who is infected is very crucial because it gives them hope. It gives them a chance for a future. Um, I also think that the stigma that is involved when people find out that you are HIV positive has to be worked on. It has to be known that it's not a death sentence anymore and that the disease can be managed. I think organizations like HARC and everything about education and prevention is so necessary. And it's about care. It's about caring for people that are already infected and preventing other people from getting infected. And it's organizations like HARC and other community-based projects that can help in that education. And I still think the emphasis needs to be on prevention. 30 years of HIV and AIDS. Um, it's amazing to me how much the antivirals have changed as far as the side effects. It used to be you took a whole handful of pills. Now they've limited it down to a few number of pills. You used to have to take medication 2, 3, 4 times a day even. Now it's just once a day, so they've came a long way in managing the antivirals. Um, I think I'm one of the lucky ones. I have survived so far, and I've buried a lot of friends that did not survive this epidemic. And it's important to remember those we have lost. And this 30-year campaign should emphasize prevention and how important it is to educate the public about not just protecting themselves, but how to treat others who are infected. And I really think the message is getting out there in a positive way.